I had no idea that there was any breathing linked to my seizures. I was doing it because of my husband's snoring. But, within that first week of the course, well, it was the end of my seizures, both types of seizures. I never had another of either type of seizure. And over the next 6-8 months, I was able to come very slowly off the medication. And that was now 8 years ago. I've been seizure-free ever since and drug. But I really thought that I had good breathing. I had absolutely no idea there was anything wrong with my breathing and any link to seizure. There is a well-known thing called early morning hyperventilation. So the most fatal asthma attacks, epileptic seizures and cardiovascular events happen in the early hours of the. And the thing with breathing that's not so widely understood yet these days is that we've got an epidemic of over breathing. Well, what I have to teach about breathing is kind of counterintuitive. The more you breathe, the less oxygen you get. And this guy had, he had a good diet and he had this physical job and he was, he surfed a lot and he should have had robust good health and healthy breathing, but he had really quite low carbon dioxide levels and it wasn't making any sense to me. So in that detective work that I do with clients, I discovered that he'd been doing Wim Hof breathing. So the thing is that the breathing exercises that would heal someone with asthma could be very detrimental to someone with panic and anxiety. It's so important that when you're working with the breathing, you're tailoring it to that person.
Hello everyone, welcome back to Health Alliance Australia's podcast. My name is Jeannie Rose Angebartha and I'll be your host today. Health Alliance Australia is a leading health advocacy organisation dedicated to honouring bodily autonomy and well-informed health choices. For those who have recently joined us, we have had amazing guests that have shared their experiences and knowledge, from doctors and lawyers discussing bioweapons, prions and mind control technology, to alternative health practitioners discussing healing modalities and avoiding being poisoned by popular drugs and supplements, to personal testimonials of healing from people who have healed from terminal cancer, Lyme's disease, and chronic fatigue, to childbirthing out of the system. Please go to our channel and check all these podcasts out. Our guest today, Nicky McLeod, is a breathing educator and Buteyko breathing practitioner who is going to discuss optimizing oxygen delivery. She has a powerful testimony of healing accidentally, I'd say, from epilepsy and partial complex seizures by doing Buteyko breathing course 8 years ago. Hello, Nicky. Welcome to today's podcast.
Hi, Jeannie.
I thought I would start today by asking you about your own story. Can you tell us about your epilepsy and how you were diagnosed? What happened there 13 years ago?
So for 13 years, I had epilepsy, partial complex and grand mal seizures, roughly one a month or a bit less than that for the grand mal seizures. They were nocturnal seizures. They were always in the early hours of the morning and safe in bed, so that was good. They came on when I was pregnant, around my first pregnancy. And I was medicated for 13 years. I was told, it was serious epilepsy. I was told that I was at risk of status, where you go into seizure after seizure and die. And when I got diagnosed, I was actually pregnant with my second child, my son, and 3 months pregnant. And I woke up in ED one night and I had 3 doctors standing over me. And I had actually had 3 seizures in a row that night. And my husband had called the ambulance. And so I was diagnosed with epilepsy then and put on medication and told it would be a lifelong thing. And I ended up doing a Buteyko breathing course 8 years ago, and I wasn't doing it for epilepsy. I had no idea that there was any breathing linked to my seizures. I was doing it because of my husband's snoring. But, within that first week of the course, well, it was the end of my seizures, both types of seizures. I never had another of either type of seizure. And over the next 6-8 months, I was able to come very slowly off the medication. And that was now 8 years ago. I've been seizure-free ever since and drug-free.
That's amazing. And of course, no one would ever connect the dots to breathing.
No, but that's surprising. If you take a child to pediatrics suspected and they suspect epilepsy, they'll do a hyperventilation provocation test quite likely and get the child to hyperventilate and see if they have a seizure. But then they won't go, oh, well, maybe there's something wrong with your breathing that, a bit of deep breathing caused the seizure. And maybe we should have a look at your breathing pattern. They're just more likely to go, epilepsy, what medication shall we put you on?
So what does the medication actually do? Like, how does it counteract the seizures? Do you know?
I don't actually know. I wasn't so health orientated back then. I didn't really look into it. I just took the drugs. It took 3 different goes. It does something, it must dumb down your nervous system because I kept changing drugs. Over the 13 years, I tried 3 different drugs. The first 2, they failed to stop my seizures, but they flatlined me. So I didn't, I just didn't get really excited. I was very, flatlined, and life was just hard work.
Yeah, and I think it's funny that you were at the same time looking to help your husband with a snoring problem, which is, very benign when you yourself had such incredible medical.
Yeah. So he had like 10 out of 10 snoring at times, and I knew that it wasn't very good for him. And also, I was having trouble sleeping. And so every time I Googled snoring, it took me to the Buteyko Breathing Clinic website. So that's my teacher, Glenn White in Auckland. He became my teacher. And just reading about Buteyko, I decided, I was a full-time mum at the time. I decided, I just had this knowing that that's what I want to do for the rest of my life. I didn't know anyone that had done it. I hadn't even done a course. Just reading about it, it blew my mind. And I thought that's going to be my life's work. I went on to train. I really thought that I had good breathing. I had absolutely no idea there was anything wrong with my breathing and any link to seizures. I tried to talk my teacher out of me having to do a breathing retraining course as part of my teacher training, because I was like, I know about breathing, I do yoga, I thought I knew it all. And he was like, oh, I think you should do the course.
So you'd already done yoga, so you had already been familiar with that kind of.
Yes, I've been doing yoga since my early 20s. And yoga is wonderful. It's great for breathing, great for the biomechanics. But, you've just got to be a little bit careful with yoga. It can lead to actually making a dysfunctional breathing pattern worse. If a teacher tells the class to deep breathe, they generally mean deep breathe as in diaphragm rather than shallow as in chest. But if you tell someone to deep breathe, they're invariably going to take a big breath. And the thing with breathing that's not so widely understood yet these days is that we've got an epidemic of over breathing already. So the advice.
But I mean, I think that's pretty common, isn't it? That when people think of breathing, they think take a deep breath in.
Yeah, and that 3-part breath, emptying and filling the lungs. We think the more the better. We think that the more we breathe, the more oxygen we'll get. But that's actually not correct. What I have to teach about breathing is kind of counterintuitive. The more you breathe, the less oxygen you get. With most people, when I do a breathing assessment for them, I put a pulse oximeter on them, and 99% of people will find the oxygen saturation is 98%. It's normal. Breathing more isn't going to get any more oxygen into their blood. They've got no problem with the oxygen diffusing through their alveoli and their lungs and getting into their blood. But the other part to getting enough oxygen and the other part to good breathing is that when that hemoglobin gets to your cells, that it's able to release the bond to the oxygen, and that the oxygen is able to move out of the blood and into the cells. And that's where carbon dioxide comes in. So carbon dioxide triggers the blood to release its bond to the oxygen, and they kind of do a swap. The carbon dioxide is coming from the cells. It's a byproduct of metabolism. It moves into the blood, is carried to the lungs, and we breathe it out. And the oxygen moves out of the blood and into the cells. But if the carbon dioxide is too low because we breathe too much or because we're not making enough for some reason, then at a cellular level, not all of that oxygen that's attached to the blood is going to get released to the cells, and it's going to get released more slowly. So that's how the more you breathe, the less oxygen you get at a cellular level. So it's a bit counterintuitive.
And I think you said somewhere there was, at times past, the Earth had high carbon dioxide levels.
Yeah, the carbon dioxide levels going back, millions of years was in the tens, and it's now down to 0.03%. There's hardly any carbon dioxide in the atmosphere down at ground level that we're breathing in. There's only 0.03% CO2 in the atmosphere now, and yet we need a certain amount in our lungs. We need a level of 6.5% carbon dioxide in our lungs. So we've evolved to cope with this low carbon dioxide atmosphere by maintaining a special higher carbon dioxide atmosphere in our lungs. And if it's low in the lungs, it'll be low in the blood. And when I do an assessment with someone, I'm using capnography, which is the gold standard for measuring the breathing pattern. And that's the capnography is bringing up the person's breathing pattern on my screen and telling me a number of parameters about their breathing, including the carbon dioxide level in their lungs.
Okay. So what other conditions could be linked to this?
So asthma,
Yeah.
hay fever, snoring, sleep apnea, chronic nasal congestion, chronic cough, impaired sporting performance, trouble with speaking, public speaking, and singing, and anxiety and panic. That's a big one too.
And
So
heart conditions?
the main ones. Yeah, cardiovascular issues, respiratory issues, COPD.
Yeah, it's interesting because I first heard of Buteyko breathing from a woman that I used to buy grain and flour from. Her husband was a farmer and he had sleep apnea. And so they went to a Buteyko breathing course and he was able to heal himself from this condition. But he also previously had cardiac issues. And I'm sort of, it's interesting how, you know, we assume that we are breathing correctly because it's a natural response. Like when you are born, the first thing a baby does is take a breath. And yet somehow the default setting in people can be set wrong. I mean, I think this is what you're essentially saying here, that if we've got wrong habits, we just continue with them regardless of what you're doing. Say you're doing yoga or sports, you haven't been, I guess, trained to have the correct breathing that will optimize your oxygen levels in your body.
So yeah, we've got an epidemic of dysfunctional breathing in the modern world, and there's a number of reasons for that. And when I'm working with someone, it's a matter of looking at that individual and what may have led to their dysfunctional breathing pattern, and working with them to normalize it and improve it as much as possible. So some of the reasons behind this epidemic of dysfunctional breathing, I'll just list off a few of them. Stress, trauma, the belief that deep breathing is good for you, you know, the wrong information on the internet, certain medications, diet, eating too much or eating too much food that's very stressful on the body, not exercising enough, over exercising. I see both of those extremes. So yeah, a lot of factors about modern life. Sometimes I, you know, try and sum it up as our addiction to our addiction to comfort and ease, eating too much, not moving enough, overheating, you know, not getting hormesis, not getting too hot or too cold, or exercising enough. Yeah, and it's a matter of talking, a job where someone talks. So someone who's on the front line, say a health practitioner who's talking all day in their job, or a hairdresser, or a teacher, that talking is a significant hyperventilation event for a lot of people. So for a certain individual, you know, when we're looking at how did they end up with this dysfunctional breathing pattern and this big list of breathing related symptoms, it may be that they've spent years talking all day, and that's fed into an elevated baseline breathing pattern. So when I'm working with someone, we're getting detective, and looking at what are the causes for that person, and what are the habit and lifestyle factors that need addressing and educating about with that person.
So with your clients, what improvements have they had after doing the course?
So when I work with someone, I take a 6-page health questionnaire before they work with me, and we go through that in their health assessment. So we're getting a baseline, and we're using the capnography also to get a baseline. And then I'm reassessing their symptoms, their breathing related symptoms, 4 days into the course, 1 week later, and 6 weeks later at their 6-week follow-up, which is included in the course. And so we're very much monitoring how they're responding and whether what they're doing is working. And if it's not, if their symptoms aren't decreasing, I'll be getting in touch with them to see what they're doing and make sure they've got the correct technique, make sure they're addressing the major habit and lifestyle factors that we've identified for them. So we're really tailoring it to each individual. And I'm also getting them to take a record of the breathing exercises they do each day. And I'm looking over them on the 4-day, each day of the course, and then a week later, and then 6 weeks later. So the thing is that the breathing exercises that would heal someone with asthma could be very detrimental to someone with panic and anxiety. It's so important that when you're working with the breathing, you're tailoring it to that person. So what you're finding, that you've done an assessment, that you know what you're dealing with that person. And trauma is another one. It helps to be trauma informed too, because everything that's ever happened to you influences how you breathe.
Yeah. So I actually thought, did you have any graphs to show what a normal breathing versus abnormal breathing? I think I've turned on sharing.
Yes.
If you wanted to try that.
When I work with people, I use PowerPoint slides. So I can show you some capnography traces. Yep. And I can show you a normal breathing pattern, what that looks like on capnography. And then I can show you the breathing when someone's having a panic attack and what it looks like as I talk them, breathe them out, help them breathe their way out of that panic attack. So
do they have some sort of mask on do they have some sort of mask on when you're actually measuring?
Yeah. So they put a plastic nasal cannula on as if you were going to be given oxygen. So the prongs are going into the nose over the ears, sits on the chest, and then that cannula is attached to the machine, and the machine is analysing the end-tidal carbon dioxide. So the carbon dioxide in the person's lungs that they're exhaling, the machine's measuring that.
Wow.
And it's bringing up their breathing pattern on my screen. So we can look at a number of parameters of the breathing. We can look at the rhythmicity and the regularity of the breathing. We can look at the rate of their breathing. We can see the carbon dioxide levels in their lungs. I can see whether they're breathing in and out adequately, or whether they're aborting the inhale or aborting the exhale, or sometimes they might be doing both. And then also I'm getting a really good window into the state of their nervous system. So the exhale and the pause are governed by the parasympathetic rest and digest branch of the nervous system, the ventral vagal branch, and the inhale is governed by the sympathetic branch of the nervous system, the fight-flight mode. So what I'm looking for in their breathing pattern, in a healthy breathing pattern, is that the exhale and the pause are longer than the inhale. So what I'm often seeing is that there's no pause, and often that the inhale and the exhale are the same length. And so then I know I'm looking at, sympathetic dominance. I'm looking at stress there.
Okay. So yeah, so if you wanted to share that would be good. We can have a little chat about that, because I think it'll be easy for people to see on a graph what it looks like, and to see a very scientific method to all of this.
Okay, so I'm just bringing up my PowerPoint slides now. So can you see my screen?
Yeah, it looks good.
Yeah, great. So this is what a capnography trace looks like. This is what comes up on my screen, and it's in real time. The trace is moving as the person breathes, and it's just a few moments behind their breathing, what's coming up on the screen. So as well as being an assessment tool for me, it's a very valuable learning tool, biofeedback tool for the client to have a play around with their breathing. See, I need to convince them often that they're feeling ear hunger, or they've got all these breathing related symptoms because they breathe too much. And that's a hard sell to someone who's feeling ear hunger. It's common for people to walk in my door and say, I breathe too much, I've got ear hunger, I can't get enough air. And they're interpreting that ear hunger as lack of oxygen, and they're trying to breathe harder, and it's getting worse.
Yes.
So the capnography is very powerful education for the person to see that You know, so I'll just start explaining the trace here. So can you see my mouse?
Yes, I can. Yeah.
I'm just looking at my other screen, sorry, while I do this. So this is the exhale. So that's the carbon dioxide rising as they exhale. And then that's the pause at the end of the exhale. And then that's the inhale. So I'm looking at the inhales coming down to the bottom line, which it is. This is a beautiful breathing pattern. The inhales coming down to the bottom line, so they're not aborting the inhale. I've got a lovely exhale with a pause at the end, 2 or 3 second pause. What else are we seeing there? So if we look up to, oh, it's not coming up on there. My machine shows breaths per minute as well, but that's not showing on this recording.
So how many breaths a minute is it normal? Like, an optimal good breathing?
So optimal good breathing is breathing that's metabolically appropriate for whatever the person's doing. It's gearing up and down according to whatever they're doing. So when I've got someone on the capno, they're just sitting, and they've often been sitting for half an hour. So for that lower metabolic requirement of just sitting, I'd be looking to see 8 to 12 breaths per minute. So anything in excess of 14 breaths per minute would be excessive for that lower metabolic requirement of sitting. Yeah, so the breathing rate, and then I'm seeing end-tidal carbon dioxide, so that's the pressure of carbon dioxide in the lungs at the end of the exhale. So the normal for that is 35 to 45 milligrams of mercury. So the line that you can see on the capno, that's set at 35. So this breathing wave should be coming up over the line. And if it is coming up over the line, like it is here with this beautiful normal breathing pattern, the person's normocapnic. But what I'm often seeing is hypocapnia. So hypo means low and capnia means carbon dioxide. So if we look at this bottom trace here, I'm seeing chronic hypocapnia there, chronically low carbon dioxide levels. You can see the CO2 levels only coming up to about 30. So looking at a pattern like that, I'd be expecting to see quite a list of breathing related symptoms and quite likely anxiety with carbon dioxide levels that are that low.
And they're breathing a lot here in the bottom graph.
Over-breathing, you can see they're breathing fast.
Yeah.
And so you can over-breathe by breathing fast, and you can over-breathe by breathing big, or a combination of the two. So this person's over-breathing, they've got chronic hypercapnia, abnormally low carbon dioxide levels. Some people are intermittently hypocapnic. When I put them on the machine, they're dipping in and out of normocapnic and hypercapnic, but this person's looking to be quite chronic. And then, so this person has, they do have anxiety, and they also have hypertension. So, it's the cardio-respiratory system, it used to be called, before it got divided into specialties, cardiology. Now you'd see the cardiologist or the respiratory specialist. But the breathing has a major impact on the cardiovascular system. So, breathing can lead to smooth muscle spasm around blood vessels and arteries, and hypertension. I've had a client who would measure their blood pressure before and after doing breathing exercises, and their blood pressure would drop 10 points as a result of the breathing exercises and the positive influence that was having on their cardiovascular system and the smooth muscle around the blood vessels and arteries. So
all this can be improved in a very short period of time.
Well, no, it's not. There's no easy quick fix here. There's a lot to this. So someone's got a breathing pattern like that. It's taken years to develop. Oh, actually, it could have developed through a stressful period or through the flu or something like that. But there can be a lot of factors influencing why that person's over breathing and got chronic hypercapnia. So we're looking at everything that's affecting their breathing. I'm looking in them, have they got any infections in their body? Because that'll be reflected in the breathing pattern. Athlete's foot, candida in the gut, cavities in the mouth, infected root canals, all of these things. Looking at trauma, looking at their diet. What do they believe about breathing? What are they practicing when it comes to breathing? That's a big one too. So when working with someone to improve a breathing pattern like this, it takes, the the breathing exercise, I teach a breathing retraining course, 5 90-minute sessions over a couple of weeks. And then they work on with everything I've taught them for 6 weeks. And then they have a follow-up with me 6 weeks later. And they're doing breathing exercises a minimum of 3 times a day. But they're also in their assessment and in working with me and over the course, we're looking to identify any habit and lifestyle factors that might also be detrimentally impacting the breathing pattern, and educating them about that and encouraging them and motivating them to address those factors to improve their breathing and reduce their breathing related symptoms. So no, it's not an easy quick fix. It takes time and a willingness to learn and address habit and lifestyle factors, which isn't easy.
So the capnography machine, are they, obviously it's quite an expensive machine, I assume?
Yes, it's a $5,000 machine. So there's only 4 people, 5 of us, 4 in New Zealand that I know of that are doing what I do, trained to my level. I'm registered with the Buteyko Institute of Breathing and Health in Australia, and using capnography and working full time with this in a clinic-based setting. And yeah, obviously that $5,000 is a bit of an impediment to people doing this, but it's been worth its weight in gold. It saves me a lot of talking. That people, we can just bring up their breathing pattern and they can see that they overbreathe, that their CO2 is too low, and then they start doing deep breathing, which they've been told is good for them and will calm them down, and their CO2 gets even lower on the capno trace. And then you know, if their CO2 sits chronically low anyway, just 2 or 3 deep breaths might be enough to bring on a panic attack. So I'm just going to show you another slide and show you that. So this is a client that was in clinic. They've got acutely low carbon dioxide levels down in the early 20s, very, very low. So that's like being on the edge of the cliff, or they're even partway over the cliff. So here we see them full-blown panic attack, where it's circled in the red with acutely low CO2. And then I start telling them what, you know, talking them out of it and guiding them with their breathing to start to raise their carbon dioxide and start to pull out of that panic attack. And we see the carbon dioxide starting to increase. So as that carbon dioxide's increasing, we're getting more oxygen to their brain, and they're starting to calm down and pull out of that panic attack. So that was a really powerful, you know, that would be quite a stressful experience for a practitioner who was in the early days of their practice. But luckily for me, I'd been doing this for about 5 years by the time this happened. So I was able to confidently guide them out of that.
What do you think yours was when you were very sick? Obviously, you didn't really measure it, did you? Like when you were...
Oh, it was acutely low. It was in the early 20s. It was acutely low. And so when it is that low, you've got unstable breathing. It doesn't take much. The CO2, you already overbreathe so much. Your CO2 levels are so low. Anything that puts the breathing up is, you know, may drop your CO2 below the threshold for, say, a seizure or a panic attack or an asthma attack, say.
Which just kind of makes sense what happened in the early morning as well, you know.
Yes. I wanted to touch on that actually, but earlier at the start of the interview, it's interesting. There's that link to breathing for me, that my seizures only ever happened in the early hours of the morning. So there is a well-known thing called early morning hyperventilation. So the most fatal asthma attacks, epileptic seizures, and cardiovascular events happen in the early hours of the morning. With that hyperventilation, really interesting.
And if you take, often, you know, you take blood pressure, if you've got blood pressure issues, which potentially could be linked to breathing, early in the morning, it tends to be higher.
Yes. Yeah.
And of course, none of the cardiologists or anyone would ever say, well, maybe you should look at your breathing.
Well, there might be 1 or 2 out there, you know. There is there's been some great things happen in the breathing world. That book, Breath by James Nestor, just has raised awareness among health professionals and doctors even. So since that book was published, maybe 3 or 4 years ago, I've actually had, you know, people referred from ED to me. You know, they're picking up the dysfunctional breathing a little bit more these days, which is really good.
So in sleeping, like, you know, like if you were doing one of these graphs during a sleeping pattern for, say, just a normal, you know, person, would the carbon dioxide levels be lower? Is that why you think people
Yes,
end up with things like teeth grinding and sleep apnea and snoring? Is that
yes.
one
So
of the
with those
triggers?
conditions, we would see low CO2 levels overnight, over breathing. Um, and but it's not just at night. Your breathing doesn't just go out at night. If it's dysfunctional at night, it'll be dysfunctional during the day. And the way that we start to work with those people is we're not going in there and getting them to control their breathing all night. We're working to improve their baseline breathing pattern during the day, and the night breathing follows.
So it's essentially you're trying to reset their baseline to train
Yes,
their brain to
yes.
think.
So someone who overbreathes, like this person, say with these panic attacks, they've become acutely sensitive to CO2. They've got used to an abnormally low level, and our tolerance to CO2 is set in our brain and the medulla oblongata in our brainstem, and there's some peripheral chemo receptors as well. And yeah, we're acutely sensitive to CO2, us humans, and we only need to overbreathe for a short period of time, like say through the flu or through a marriage breakup or something like that, to overbreathe, drop our CO2, and then get used to an abnormally low level of CO2 and breathe going forward in a way that maintains the abnormally low level. So that's what we're working with. We're getting in there and targeting that, identifying it first with the capnography, and then going through a very specific, very highly tailored process to push the carbon dioxide tolerance back up to normal.
Are there other things that people can do apart from retraining the people that you support in their life to assist them? Like, like obviously, if sickness can push you one way, are there things that they can do in their life that will benefit their to bring back a better baseline carbon dioxide level?
Yeah, they can get moving, or if they're over exercising, bring it back. Start learning to exercise um, within their breathing capacity. So I'm teaching them to with their exercise that comes. There's a whole module on breathing for exercise on day 4 of the Buteyko breathing course, teaching them to go at a pace that enables them to nasal breathe. So that's vital that they're doing that while they're working with me, because if they just continue to charge around exercising beyond their breathing capacity with their mouth open, then that's actually going to work against what we're trying to do in terms of raising their carbon dioxide tolerance and bringing their drive to breathe back down to normal and normalizing their breathing pattern. So that's
things like walking and
yeah,
what, running, swimming.
it's great. And it may be that they're running, but they're doing it all mouth breathing and hyperventilating, and they've got anxiety and panic and all sorts of breathing related symptoms as a result. So I'll be saying to them before I agree to work with them, are you willing to, leave the running aside for now? We'll get you running again within a few weeks, but you've got to be prepared to put your training regime aside, say if they're an athlete, or put your your fitness goals aside for now, and prioritize the breathing and go at a pace that enables you to maintain nasal breathing. So they might need to pull it right back to just gentle walking on the flat initially. And once they can do that, then they might be able to speed up and then slowly add in the hills. We'll get them back up to running, but they've got to be prepared to pull right back initially, or it's going to undermine what we're trying to do.
And obviously things like if they spend a lot of time talking.
Yeah, yes. So that's
singing.
Talking is a major hyperventilation event for a lot of people. So if you notice that talking is triggering breathing related symptoms like coughing, or going lightheaded, dizzy, or even a panic attack, talking, if someone's got acutely low CO2 like this person, just talking would be enough to drop their CO2 below the threshold to cause a panic attack.
So are there any other ones you want to show us? And then I will just close the, otherwise we'll just close this.
No, I don't have any other.
So you just want to close that screen?
Sure.
So I thought we'd also talk about how that carbon dioxide relates to acidity in the body and inflammation, because, to tie that in to other health things. So I think I'd heard you say in other podcasts about how, was it low carbon dioxide in the blood causes alkaline, or was it high?
Yeah,
Low.
so the most important thing in your body is the pH of your blood, the acidity, alkalinity of your blood, and it needs to be maintained in a very narrow range, 7.35 to 7.45. And if you think of carbon dioxide as acidic, if you're over breathing and you're breathing out too much of it, you're ventilating off more than you're making, then the blood's going to shift in the direction of becoming a little bit more alkaline. And just over breathing a little bit and making your blood a little bit more alkaline, there's a whole cascade of physiological effects, breathing related symptoms that can relate, that can be caused by that. So as I said in that other podcast, I was talking about asthma. Generally, everyone that I've done an assessment for with asthma, their baseline breathing pattern is one of over breathing and their CO2 being too low and their blood being a bit more alkaline. But then that's confusing, because when they have an asthma exacerbation and there's air trapping, because they've got smooth muscle spasm around the airways, the airways are inflamed and they've got this increase in mucus production, and the airways have become so small that they can hardly breathe out, and the CO2 is being trapped. Well, then they're heading towards acidosis, and if the blood becomes too acidic as a result of that, they'll die.
Yeah, and
So
it obviously causes a lot of other diseases as well when
yes,
you're shifting that in a certain
yes,
direction.
yeah.
I mean, I think it's actually quite incredible to think
It-
something as normal as breathing. So at this point, I was thinking too, like there's a lot online with regard to breathing at the moment, and obviously as someone who has been in this space, some of it might be quite disturbing to you of what you're seeing, because people are taking a sort of a do-it-yourself approach,
yeah,
and
people are
there's,
looking to the internet to get ideas, and
because it's counterintuitive what you're saying, that if people feel like they've got an issue with their breathing or low oxygen levels, they think, well, what I'm going to do to fix it is to do deep breathing. And is there a difference between diaphragmic breathing and Buteyko breathing?
there's a lot more to the Buteyko method than just diaphragm breathing. Diaphragm breathing is one aspect of a healthy baseline breathing pattern, that it's predominantly 80% from the diaphragm and only 20% from the secondary respiratory muscles in the shoulders, neck, and chest. So when I'm working with someone, generally I'm finding upper chest breathing, predominantly upper chest breathing. One of the issues, so one of the aspects of a normal breathing pattern is nasal breathing. And when you mouth breathe, well, straight away you're going to breathe double or triple or quadruple the amount of air than is normal. But also you're going to engage your secondary respiratory muscles. And when we breathe from those muscles, we engage the sympathetic nervous system, the stress branch, the fight-flight branch of the nervous system.
And that affects our breathing, yeah.
Yeah. So diaphragm breathing, the diaphragm facilitates the whole body to work better. The diaphragm's, not only a breathing muscle, it's also a postural muscle. The vagus nerve goes through the diaphragm. It's involved in, nervous system regulation. Every time the diaphragm moves, the kidneys move in 5 centimeters in either direction. The diaphragm's fascially connected to the heart. It's massaging the heart and influencing the heart in that way. And also you've got all your organs tucked up under the diaphragm. And whenever you breathe, if you're breathing predominantly from the diaphragm, it's squeezing and releasing those organs and tuning them and bringing you blood supply in. So yeah, when I first started working in this field, I thought that the amazing results that people can achieve with the breathing retraining program were just down to normalizing their CO2 levels and increasing the CO2 levels. But I've come to think that it's just as much about establishing the diaphragm, predominantly diaphragm breathing at rest, and also about another gas, nitric oxide. So nitric oxide's made in the sinuses and in the lining of the blood vessels. We've got to breathe through our nose to collect it and take it into the lungs and into the blood. So mouth breathers miss out on nitric oxide, and a breathing retraining course will optimize nitric oxide levels as well. And there's a number of benefits. Nitric oxide has got as many benefits to our health as carbon dioxide. Yeah, so it's triple fold. It's the carbon dioxide, the increasing and normalizing of the carbon dioxide levels, the optimizing of the nitric oxide levels, and also all the benefits that we get from shifting to a more of a predominantly diaphragm breathing pattern.
So is there some sort of recording that you give your clients that would say?
So I teach in clinic and on Zoom, and I teach around New Zealand and overseas because I can teach on Zoom. And if someone can't make a session, then I'll record that session for them and make that available to them. But no, I mean, I did do another podcast recently, which I might send people if they're interested in breathing retraining and want to learn more about breathing and how it influences health. But no, at this stage, I don't have any recordings. I'd like to get to the point where I have recordings on various breathing related topics on my website.
So like, you know how there's all these apps where people can say, breathe in, 1, 2, 3, breathe out. Is that what you would do?
Well, I will never do that because what I would teach someone, the breathing exercises that I would teach someone is going to depend on my assessment of their breathing and their health. And as I said earlier, the breathing exercises that I would work with someone with asthma that could lead to no more asthma and no more medication could make someone considerably worse who's got panic and anxiety. So I'm not a fan of, there's no one size fits all. It's really important if you're looking to work with someone with breathing that they have done an assessment, that they, they're, for example, breath holds, strong breath holds, they need to be used with extreme caution. I only use them with a small percentage of my clients. There's a lot of contraindications to doing breath holds. But even something like that, let's see, this is the benefit of me having the capnography, is I can, in my breathing assessment with them, I'll say to them, are there any breathing exercises that you're currently doing that you've learned online? And they might say, oh yeah, I do the 2, 4, 8 breathing exercise or box breathing. And I say, okay, I want you to do it on the capnography. And we'll see if it's actually improving your CO2 level and your breathing pattern, and if it's actually having a detrimental effect. For some people, it will be really effective and it will improve their CO2 levels. For others, it will drop them. The same exercise, advantageous to one person, detrimental to another. And for all of these breathing exercises, they seem very simple, but often there's quite a lot to them. And if you get something wrong, something that should be good for you won't be.
So this, like, obviously, the Wim Hof method, I mean, they have a control pause of sometimes a minute or longer, and that's very much part of the thing. So I'd be interested in your thoughts on that, because it's obviously one of the most popular ones out there. Wim Hof is kind of
it has advantages, and if it's used appropriately for someone who's reasonably fit and healthy with no contraindications. But my concern is that often there's been no assessment of the person's health or breathing. There's been no awareness of the contraindications. Does the teacher know if anyone in that big class that they're teaching online has seizures or has a cardiovascular issues or has asthma or panic and anxiety? So these are all situations where the Wim Hof method could be quite detrimental.
Yeah, it makes sense really when you think about it. Like, the Wim Hof method with, these edgy kind of exercises, and then the cold ice baths for someone who has a heart condition or anxiety is simply probably not going to be very beneficial for them to
No.
do that.
So I'll always remember a man I worked with who he should have had great breathing. He had a physical job. So people who have who have physical jobs and are more active tend to have better breathing. And this guy had, he had a good diet, and he had this physical job, and he was, he surfed a lot, and he should have had robust good health and healthy breathing, but he had really quite low carbon dioxide levels, and it wasn't making any sense to me. So in that detective work that I do with clients, I discovered that he'd been doing Wim Hof breathing.
Okay.
Yeah, and that was why.
Yeah, the reverse of what he
Yeah,
probably should have been
yeah,
doing.
yeah, it
Yeah.
hadn't been, it had dropped
Of course,
his.
you wouldn't know that unless you put him on a machine, and then you do
Mm.
the exercise, and then you suddenly discover that. I mean, I guess one of the factors you could probably try if you didn't have a machine would be to take your blood pressure before and after, perhaps even, to see what sort of improvement do you think, like, is it more of a, I mean, obviously it's not 100%, but you would
Taking the blood
expect
pressure.
a good blood pressure after a breathing exercises that you were doing would be lower.
Not many people have a blood pressure cuff at home though. Easier and cheaper would be, to monitor the heart rate before and after. What's the heart rate like afterwards and half an hour later? If it was beneficial, I would expect that you'd have a lower pulse, for example.
Yes,
And
yes.
then there's things like heart rate variability. Yeah, there are a number of parameters that can be measured. And as a Buteyko practitioner, I'd be wanting to take the control pause before and after.
Yeah, can you explain for the listeners the control pause?
Okay, so it's come from the Buteyko method. It's a short breath hold until the first distinct urge to breathe. And what we're measuring with the control pause is your carbon dioxide tolerance, your drive to breathe. So, as I said, we're continually making carbon dioxide, and we breathe it out. And when you hold your breath, it's going to accumulate. And the more you overbreathe, the more sensitive you are to CO2, the shorter your breath hold time will be. So the control pause, it's on my website, the breathing clinic, if anyone wants to have a look up there and follow the step-by-step instructions, but I can talk you through it now. So what you do, and it's a very simple test, but there's quite a few things, quite a lot of leeway to get it wrong. All the little details about it really matter. So it's really important that you don't empty and fill your lungs beforehand. So it's taken after an exhale, but it's really important that it's just a normal exhale. So after the next exhale, normal exhale, hold your breath and block your nose. And you're going to start a timer, and you're going to measure how many seconds until you get that first distinct urge to breathe. So you may feel a push in the diaphragm, you may feel a push in your throat, you might just think, I need to breathe now. And at that first sign of any kind of respiratory response, you're stopping the timer, and that's your control pause. So, it could be 8 seconds, it could be 20 seconds. A healthy control pause is 40 seconds and above. 60 is ideal, but in the modern world, 40 is pretty good. Under the 10-second zone, there will be health issues in that person, and a reasonably high breathing related symptom score. So under 10 seconds is that worst zone to be in. So when I was having seizures, when I first did my course, my control pause was 8 seconds. But I sometimes work with people who are having panic attacks on a daily basis. Their control pause will be 1 or 2 seconds.
Wow.
That they're in serious trouble. And you have to work very gently with them if their drive to breathe is that high and their CP is that low. So just getting the control pause into the 20 to 30 second zone can make a significant difference to someone's symptoms and life. Getting into the 20-second zone for someone with asthma, they're likely to be able to come off their Ventolin.
Yeah, and I think I saw that. We saw that in the BBC documentary, which we'll put in the
Yes.
comments as well,
And,
where they followed a few patients who healed of asthma, and they treated bronchitis, got off medication, because they were able to extend their control pause in the training that they got.
and also someone with panic and anxiety, they're not going to be getting panic attacks by the time you've got them into the 20-second zone. So if the hardest threshold to cross is that 40-second zone, and you're looking at pretty high levels of health, if you can get up into that zone. But you have to be prepared to work reasonably hard to get a control pause of over 40 seconds. But with a CP under 10 seconds, the breathing's pretty unstable. The person has to be just doing very gentle exercise with a CP that low. That's really important. Once the CP is above 20, then we can start to push it more with physical exercise.
Yeah, it's a good test, I guess, for people to check on themselves, just like checking their weight or something that they would do. So you don't actually take a deep breath first. You just...
No, it's really important that you don't alter your breathing in any way. Just after the next exhale, normal exhale, block your nose and hold your breath. And then really important too, to make sure you did it right, is to monitor your breathing closely afterwards. So if you've done it correctly, that first breath after, it won't be a big, it won't lead to an increase in breathing. It won't change the breathing at all if you've done it correctly. The breathing before will be the same as the breathing after will be the same as the breathing was before. So if you're having to, and you should be able to nose breathe afterwards, that's vital. So if you're having to open your mouth and gasp, or you might be able to keep your mouth shut, but you're visibly doing a few big breaths afterwards, that's not a control pause. There's no willpower involved in the control pause. It's just,
I mean, of course, it's a test. So often, people think, oh, I want to get to that 20-second, 40-second mark, and I'll just take a deep breath and then hold on for as long as they can, and then gasp for air afterwards. But you're saying to be honest with yourself.
Yes, exactly. So if it does lead to an increase in breathing afterwards, you need to be really honest with yourself and dock yourself a few seconds, or do it again, but don't do it again immediately. Otherwise, the test you just did will influence the next one. Just take your focus off the breathing for a few minutes before you try it again. Sometimes
do you work with people with their posture and their tongue position? Is that part of the whole, when you're sitting there and breathing, they have to be in the right position to activate all of those?
Yes. So when I'm working with people, I'm taking them through 8 healthy habits of breathing. The first one's awareness. The next one is relaxed upright posture. So yeah, whenever the breathing's not ideal, the posture isn't ideal, the breathing also won't be ideal.
And of course, when people are looking at their computers all day, their posture is already quite bad, with the reaching and their phones and so forth. So that's all impacting on people's breathing.
So when I'm looking at reasons for a poor baseline breathing pattern, I'm often looking at their job. If they've got a job where they sit for 8-10 hours a day, that's very much going to be working against their breathing health. They're not moving enough. The longer they sit, the more gravity is working against them. The longer you sit, the harder it gets to maintain a relaxed upright posture. You're fighting a losing battle. So I'm encouraging people to invest in a desk riser, so that they can stand for part of the day, so that when they start to feel that slumping starting to happen and they're starting to have to fight against it and it's getting hard work, stand up for a little while. It can make an enormous difference to breathing. There's studies coming out lately showing that that sitting is as bad for you as smoking.
Yeah, that's crazy. Do you think that mouth breathing is more a symptom of something else, and therefore just taping the mouth is, it's not something that should be done as a, like it's like a band-aid fix? Or is it possible to fix mouth breathing simply by, there's lots of suggestions often with just tape your mouth at night time?
No, it's not that simple. And we're quite concerned. Mouth taping's been taken from the Buteyko Method and taken out of context, and is now just being, recommended by dentists and doctors. It might be okay, it's okay for some people, but it's risky. If someone's got a really low control pause and an over breathing pattern and anxiety, for example, all you're doing by taping at night is forcing nasal breathing. And so if someone's got abnormally low CO2 levels and they've got panic and anxiety, you've got to raise those carbon dioxide levels very gently. It's a lot of skill to work with panic and anxiety with breathing. And just taping and forcing nasal breathing at night may raise it. very fast, and they may wake up in the middle of the night with a full-blown panic attack. Certain cardiovascular issues, if you're going to force nasal breathing, may put pressure on the left-hand side of the heart. I've got an article about this on my website, the perils of mouth taping, warning that it's not as simple as just taping your mouth shut. And, taping the mouth shut we possibly use it in breathing retraining. We don't use it for everybody. And it's done very gently and we're looking to make sure there's no contraindications to it. And it's just a little bit of tape vertically. It's just a guide. And if it tape's coming off at night, we know that they've still got an elevated drive to breathe. Their breathing's still dysfunctional. It might take a month for that tape to stay on while they're working on improving their baseline pattern, their breathing pattern during the day. And it can take a while for the night breathing to follow. But we know we're really starting to get somewhere when the tape's staying on at night and they're starting to nasal breathe all night. So yeah, you can't fix a dysfunctional breathing pattern just by taping.
So what I'm hearing is that you're saying that through these exercises and you're retraining someone to breathe properly, that you increase their baseline carbon dioxide, their brain becomes more used to this higher level. So it's more of a gradual change until it becomes their normal.
Yes.
And then all the other issues like mouth breathing and all the other symptoms, anxiety, whatever health issues they're suffering, kind of correct themselves, just like for yourself. You did the training and then all of a sudden you found that your issues with epilepsy just vanished.
So there's a lot to improving a poor baseline breathing pattern and normalizing the carbon dioxide levels. So a breathing educator, if you take a breathing practitioner, we're looking at all aspects of the breathing pattern and we're looking to normalize them in all situations. So we're looking at the rate, the route, the rhythm, the volume, and the locale of breathing. So the rate, how fast they're breathing, the route, whether they're breathing through the nose or the mouth, and normal is, full-time nasal breathing. The rhythm, so that's the rhythmicity and the regularity of the breathing. So things that might interrupt that would be frequent coughing, yawning, sighing, throat clearing. So we're looking to normalize the rhythm. A normal healthy breathing pattern is smooth and regular and even. Volume, so that's minute volume, that's the amount of air that they breathe in 1 minute. So a normal minute volume is 4 to 6 liters of air per minute. But what we're seeing in panic and anxiety, asthma, snoring and sleep apnea often is 12 to 15 liters of air per minute. Breathing 2 or 3 times the norm, the physiological norm for a human. And then locale, that means which muscles they're using to breathe. So at rest, they should be breathing, normal is 80% diaphragm breathing. So we're looking to normalize all of, or improve as much as possible for that person, all of those aspects of breathing in all situations. So it's no good just having great breathing when you sit on the yoga mat at the end of the day, or sit down to meditate, or when you sit on the couch at the end of the day. We want to normalize and improve your breathing pattern when you're exercising, when you're talking, when you're eating, as you go about your day, and in all situations.
So the captography is really only available to those people in New Zealand who are able to access you. When you do your Zoom sessions with people online, how do you obviously assess them a different way?
Yes, so that's the only difference with the Zoom breathing assessment, is that we can't use the capnography. But there's a number of, it's still a very valuable appointment with a lot of education, and the person gets a whole lot of initial recommendations after that appointment to get started to work with, depending on what we find. But I'm using a 6-page health questionnaire, so taking a very detailed health history, and I'm using that and doing an interview with them and going through that health history and getting more detail. And then there are my observations. So on Zoom, I can see them from the waist up. If they've got a chronic sighing or yawning pattern in the upper chest breathers, I'll be observing all that and picking that up just as well on Zoom. And I'll be using the control pause. I can't use the capnography to see their breathing pattern, But, you know, I take the control pause, and from my observations and their symptom tracker and their health questionnaire, that gives me the picture.
Fantastic.
Yeah.
So is there anything else that we haven't covered today that you wanted to cover?
No, I can't think of anything off the top of my head.
Yeah, it's been very interesting and valuable information. I think, you know, with all that's out there at the moment, cutting
Yeah.
edge in a way, you know, because people will just go along to YouTube and they'll find something like and obviously if they're healthy, probably no real issues, perhaps except for, you know, the exceptions when it is contradicted. Of course, you don't know that until you've hit a brick wall with your health. So you can be found at breathingclinicco.New Zealand and on Facebook.
www.breathingconnect.co.nz. Yes, I did just want to say a little bit to what you just said, a little bit more, is that the breathing field is a little bit like the trauma field. It's reasonably it's quite new and unregulated. You have to be careful, you know, what information you're getting and who you're working with. Yeah, breathing is very powerful. It can have a massive impact on your health. It can affect
Either way.
every system. So you want to make sure you're working with someone who's suitably trained and qualified, and you know, has a professional body. There's a lot of stuff out there called breath work, and what I do is not breath work. What I, you know, Buteyko practitioners working with, you know, all aspects of the breathing pattern, in all situations. It's very thorough. There's a
It's
lot.
very scientifically based in a lot of ways.
Based as well, grounded, yeah, in the Bohr effect, BOHR. That's something people can look up if they want to learn more about breathing physiology, the Bohr effect. So yeah, I'd just say, be careful, do your research, do your homework. You know, if you're going along to a breathing class, they haven't taken got you to fill out any form whatsoever and found out anything about your health, and then they're teaching standard exercises to a whole room full of people, and they have no idea what their health conditions are or what their contraindications may be, I'd say run like hell.
Yes.
Yeah.
One size fits nobody. And
No,
obviously sometimes
exactly.
it works perfectly fine, depending on your situation. But when it doesn't work, it can be quite disastrous, I imagine, because as you
Yes,
say, breathing is very powerful. So
yes,
if we start to practice something that is wrong, that causes our carbon dioxide levels to fall in the blood, then we're going to end up with all sorts of health conditions.
yes.
So anyway, we're going to post all the important links related to this podcast in the description on our website, healthallianceaustralia.org. So come back and check those out. In closing, Health Alliance Australia posts harmful health measures, laws and mandates, and provides educational content that will hopefully inspire you on your health journey. Please distribute as we are heavily censored. Email or message it to your friends and family. You can help with the algorithm by subscribing, commenting, sharing, and liking the content on YouTube and Rumble. Our website, healthallianceaustralia.org, has more about us. Please join and support our work, including our free mailing list. Thanks, everyone, for watching, and thank you, Nicky, for your time today.
You're very welcome. Thank you very much, Jenny.